As many of you have noticed, COVID cases are continuing to rise around the country and here in Texas. You can see nearly 9,500 new cases reported statewide in Texas just today. Let's check out the viewing area as we zoom in closer to home. You can see just over 900 new cases in this red area here reported today. As you go county to county, you can see 200 in Williamson County, more than twice that in Travis County at 450, and in Hays County 140 new cases reported of COVID-19 just today. Now the CDC updated the community risk in Central Texas today. Mason, Gillespie, Blanco County all improving, so that's good news. But Fayette County worsening from medium to high risk this week. Now all other counties remain the same, meaning Hays, Caldwell remain high, as you can see here in our southern two counties there, Hays and Caldwell in red as we enter today. KVUE's Matt Fernandez was able to speak with a medical expert today. Matt, what did he say the big reason is behind the increase of COVID numbers?
Brian, I spoke with Dr. David Winter with Baylor Scott and White, and he says the BA.5 subvariant is a big cause in the increase in numbers. Dr. Winter, who is an internal medicine physician, says 75% of the new COVID cases are the BA.5 variant. He says this variant is more contagious. In addition to the cases going up statewide, he says that hospitalizations are up 20% in the last 2 weeks. There are currently 3,400 Texans with COVID-related cases in the hospital. He says the majority of those that are in the hospital are unvaccinated, and he encourages people to get the COVID-19 vaccine. He says even if you do contract COVID, it would reduce the severity of the symptoms, and the majority of the cases will be mild.
If you hadn't had a vaccine in the past 4 or 5 months, it's time to consider getting one. Get your first vaccine or get your first booster or your second booster if it's been more than 4 or 5 months since your last one.
He also recommends Paxlovid, an antiviral pill. If you get COVID, it's the same thing President Biden is using right now. He says it drops the chances of serious illness by 89%. And Winter says some of the elderly are the most vulnerable and need to be careful with COVID-19 and this new BA.5 variant.